It's time for the Half Hour to Health with Dr. Bob and Debbie DeMaria. Call a friend or family member now and let them benefit from today's exciting and informative program. If you want to lead a healthier life, the time is now.
Hello, this is Dr. Bob and Casen DeMaria with another Half Hour of Health for you. And I'm going to tell you what, I've been practicing since 1978, and we've had some tremendous guests on our program. And I'm not even sure if Sandy knows how important this program is, and we are so blessed to have her here. When you hear this testimony, if you know someone that has gone to a physician and has been literally almost forced to have surgery, which I think is malpractice, and I'm not saying you should ever not be checked by your healthcare provider, but before you are forced or manipulated into having surgery, you should call our office first. And you're going to hear why right now. Sandy.
Yes, sir.
That was a lot of pressure, wasn't it? No.
No.
So you came into our office, and first, you look awesome. Would you mind telling everybody your age?
I was 70 in September.
So so you even looked good before you even came to see us.
Oh, well, thank you.
But, and that's a really big but, when you came into our office,
Yes.
you had some challenges going on in your body.
Yes, I did.
You had some major problems happening. So would you mind first just talking about what exactly you had going on inside of your spine and your body and your symptoms, et cetera? And Dr. Casen, I'll let you talk about the spine. So talk to our audience.
A year and a half ago, I had to have a hip replacement. And that was due to some things in my spine. I had had MRIs, x-rays of my back and spine, terrible, terrible lower and upper back pain and down through the shoulders and in the neck. And they did MRIs of my lower back and they diagnosed stenosis and several other terrible things. And were recommending surgery, but they said they wanted x-rays and MRIs of my upper back before they touched the lower back. And when they saw those, the surgeon immediately wanted to do surgery. He talked about stenosis and other bad things going on in my neck that were shutting off a lot of things, including nerves and such, to my body.
Now, how long ago was that?
This was the middle of October, near the very end of October.
So that was for the whole purpose of the program, because this could be watched any time. So in the future, we'll say about a month ago?
Yes, yes, it was. And about a month ago, I had all of these x-rays, and I just could not get a piece. The surgeon, the minute he saw my MRI of my neck and the x-rays, he wanted to do surgery the following, well, about a week and a half later, immediately. He was willing to move his surgery schedule in order to get me in. He felt it was that bad and that I had to have it done immediately.
What kind of symptoms did you have a month ago when you came into our office, or before you came in? What prompted you to, what were the symptoms that prompted you to call?
The extreme pain and inability to do much in the way of movement, difficulty walking, terrible pain through here, in here, and
what were you doing that brought that on? I don't mean to interrupt you, but this, for our just purpose of people listening to us, what were you doing that happened prior to this?
Well, I had had a very, thank you for reminding me of that, I'd had a very bad fall several months before all this had happened, and some of the x-rays showed that I had bulging discs and different things going on in my spine, but the pain that had begun several months earlier had put me down in bed for almost a month.
So you were down in bed, and then you got up, and whatever happened, you fell down and had another injury.
Yes.
In the interim time, you've also had hip surgery.
That's right.
And so you went to this surgeon with these pains, and he said that you need to have surgery basically immediately.
Immediately, if not sooner.
Okay, so kind of use fear?
Yes.
Okay, I'm just asking because see...
Not only for myself, but for my daughter who was sitting there with me. He had asked for her to come along to the appointment. And it threw fear into not only myself, but her. And we walked out of there prepared to actually make the surgical appointment, which I did that day.
You did?
Yes, I was to have surgery, but I knew I was seeing you that afternoon.
So let me ask you this then. So you went to the surgeon, you were going to have surgery, and then you had a friend that suggested that you come into our office.
Yes, I had known of your practice through television several times, but Elyria seemed very far away. However, my friend lived clear over on the east side of Cleveland, and she came down to see you every week. And she kept convincing me that I should see Dr. Bob, see Dr. Bob. So I did that.
So you came into our office, we did an assessment, we looked at your films,
Yes, you did.
and your daughter was with you.
Yes, she was.
So we had, you know, nose-to-nose, cheek-to-cheek conversation. And then I suggested to you, I think Dr. Casen, you gave her a first adjustment.
I did.
Yes.
So that put a lot of pressure on you, didn't it?
I know. I did your examination also.
That's right, you
so
did.
I know that when you first came in, I just remember that the shoulder was a huge issue for you. Even things like people, you know, they getting dressed and things like that, but you were having difficulties doing anything.
Yes. Yes.
So why don't you talk
I
about what,
will.
because this is intense.
So specifically with Sandy, she kind of already had a background in understanding that something was going on with her spine, and the surgeon told you that it was stenosis.
Yes.
But at home, someone might not understand the word stenosis. Basically, it just means narrowing of the spine. And in your spine, there are these holes that come out the side, and they're called your intervertebral foramen, which are the tiny holes that your nerves come out to supply specifically things like your lungs, your heart. But in your case, it was your shoulder. Because all of these nerves up here, they were being compressed, which is what we call a subluxation. They were literally squeezing the nerve energy going to your shoulder. So someone might want to operate on your neck or your shoulder because of that subluxation in your spine. And specifically with Sandy's case, her upper cervical spine was not moving fluidly how it should. So when you go forward, your spinuses should separate, and when you bring your head back, they should approximate together. But in your case, nothing was moving, especially in this lower spine here. So on Sandy's first adjustment, we were strictly focusing on her lower cervical spine, where those nerves were coming out to supply your shoulder. And how was your first adjustment? How was that experience for you?
It was a relief. I could feel right away.
And that was after one adjustment.
You know, I know this is, we're going to go slow with this all this. So we have specially designed tables that are very sophisticated. So when you come and make that wise choice to come into our office, this is not a traditional, typical chiropractic office. This is advanced technology. I have been practicing since 1978, have a degree in spinal engineering, have a degree in chiropractic orthopedics, have a Doctor of Natural Health degree. Dr. Casen and Dr. Anthony have been specifically trained in motion-specific chiropractic care. We do specific x-rays. I believe we may have sent you out for films, or maybe they had those films done to her already. And so when Dr. Casen and I consulted with Sandy and Dr. Casen completed the examination, we only needed to move 1 or 2 vertebrae. Now you're going to say, so here's Dr. Casen, and we have this fine lady here who is facing surgery, and you trusted her to take your neck that was supposed to get operated on, and by the grace of God, which thank you Jesus, she did this adjustment, and you got better. And you've had how many adjustments now?
4.
4 adjustments.
Yes, which is only 2 weeks.
And so right now, the hospital will either just be figuring out your name and what you to eat. They would have probably killed you with Jell-O. And I am just having fun with you all out there right now. But we hear this day in and day out. And I've been doing this for 35 years, touched 750,000 people. We know you don't know what to do. And so Sandy was so kind to come. 4 adjustments. I don't know how much that surgery would have cost. Do you have any idea?
Too much.
So let's just be conservative and say the surgery would have been 10 or 12,000 plus hospitalization, not being able to participate with your family, possible complications, including who knows what. because
Yeah.
people do die.
Cadaver bones going into my neck did not please me.
We need to talk about this for a moment. Cadaver bones. Now, I don't know, let me just talk about this. A cadaver bone is taking a specimen from someone who's dead, okay, dead person. Now, if you know anything about physiology, you cannot take a bone from a dead person and put it into a living person and expect over time that your human body's not going to do something to that bone. Because I've had other patients come into my office that have had specimens taken from other creatures and other parts of other people's bodies, and the body absorbed all those nutrients. Now, what probably would have been more logical to me would have been maybe to take a piece of your own pelvic bone, take the disc out, make the repair, and place your own pelvic bone. And I am not a surgeon, and I'm not saying the surgeon was right or wrong, but once again, Dr. Casen, myself, and Dr. Anthony hear these all the time, and people see. We have a patient right now that's had 10 spinal surgeries. 10 spinal surgeries come into our office, and within less than a month, pain has gone away. We know that there are hundreds of thousands of failed spinal surgeries right now. We also know a lot of you had cortisone injections. You know, people can die from these injections right now. So this is not a game that we're playing. This is serious stuff. So if you're having pain in your body right now, because we've done this for such a long time, they need to come and see us, don't they?
Oh, yes, definitely.
So talk to us about your relief. So you had numbness, etc. So talk to me right now.
I've noticed that the numbness that had been through nerve endings is, and I knew it would take a while, is subsiding.
Okay.
Not overnight, but it's subsiding. The pain in my lower back is so drastically different, I can't even describe it.
Excuse me, have you done anything to her low back?
No, not really. We're basically just focusing on her cervical spine, and we've done a little bit of work to the low back, but her main issue is your low back pain is coming from your neck.
From the neck?
Because what happens is in your spine, if your neck is shifted forward like this, due to the law of gravity, what happens is your pelvis wants to go underneath that to support your foundation in your whole body. And especially with you with hip replacements, we've been seeing an epidemic of especially women with hip replacements. And what happens with the pattern of a hip replacement, it has a certain and specific way that it shifts your pelvis.
So I'm going to give you a moment here. Would you say you had a miracle?
Oh, absolutely.
So we could confidently call this
Absolutely.
video, "Miracle Happened, Women Did Not Need Surgery," because we'll put this on the internet, by the way.
Yeah.
And so we're talking to the whole world right now.
Yes.
I want you to look into the camera and do you talk from your heart? Because there's someone on a couch somewhere in the world right now that's going to come to Cleveland, Ohio because of you. And I want you to be there when you meet them.
I'd be very honored to. I have been a proponent of alternative health, if you will, for many years. I have to say this is absolutely my most astonishing experience, and yes, it was a miracle to which I give God and the doctors all the glory. And I can only encourage you that if you have anything in your body that's bothering you, consider Dr. Bob and his staff before you ever go into surgery of any kind. They not only give you opportunities through the spine, but they are so wonderful in their natural food care, which helps the body as well, that I just can't encourage you enough. Get here.
You did awesome. And that was all not solicited. So
No, it
listen,
wasn't.
wherever you're at, anywhere in the world right now, CLE, that's where you fly into. Look at the number on the screen. Email us. I promise you, God is my witness, we'll do whatever we can to make a difference in your life. We'll be right back. Hello, this is Dr. Bob, Anthony, and Casen DeMaria, and I'd like to invite you to join us at our office. We are here to make a difference in your life. We will listen to you. We will listen to every complaint you have and help you make wise choices for your long-term health problems.
I just want to invite everyone to bring their kids into our office because we have so much fun and we know how we can make a difference in impacting not only the kids but also your family, just helping them reach that optimal level of function.
And one of the things that we're blessed to use is some advanced technology with how we go about your care. So we're able to do special thermal imaging of your spine and do motion x-rays. And we're also just able to use some biocommunication devices in order to figure out the best plan of care for your specific case.
So what's going on in our particular practice is that we have high-end technology. We've been skilled, trained, and experienced. We will listen to you. We know that you want wellness. We look at the whole package. We look at the whole person, regardless of whatever you've had done to this point, whether it be surgery, you're on medications. Give us an opportunity to serve you. We have taken care of this area for over 35 years, and we have the expertise to make a difference for you and your family. We have educational material that's available to you. We have material that's available in the form of books and technology. So we'd encourage you, regardless of what you have going on, that you give our office a call today. Let us make a difference for you and your family. And we're also available to speak at your business, your organization, or your church. We love treating families. We love chronic problems. Give us a call today. You'll be glad you did. Hello, this is Dr. Bob, Anthony, and Casen DeMaria, continuing on once again with the Miracle Half Hour of Health. I'll tell you, that was a tremendous testimony, and I really wanted you all to hear that wherever you're at in the world, because I know that someone's going to come. Many of you are going to come. Thousands of you are going to come, because we want to make a difference in your life. Let me talk to you a bit about the mechanics of this, because Dr. Casen did such a fine job explaining, but I wanted to show you this mechanically. So when your head goes forward, we have this printer cable wire here. That head going forward puts a pull down here where Sandy was having her low back problem. So by Dr. Casen just gently maneuvering this area right here, it literally was enough. Because see, in the spine, millimeters are miles. So just gently starting to change this, 4 chiropractic adjustments to get this relief down here, plus up here. Because see, there are complications from surgery. And I'm not telling anybody not to have surgery. And I am not trying to create distress. But I know right now that there are so many thousands of failed back syndromes. And I could comfortably and confidently tell you, yes, we've had patients have 10 spinal surgeries. So we're just trying to prevent you from being one of those unfortunate consequences. So I'm going to have Dr. Casen and Dr. Anthony explain to you a little bit more about this whole hip challenge that we're seeing and some of the other complications that we are seeing from patients, and we want to help beforehand.
So one of the things that was really important about what was going on with Sandy's case, and when she was talking with Dr. Bob and Dr. Casen about giving them the glory as well as to God, the most important person is Sandy's own physical body has the ability to heal herself. It just needs no interference. So what we are is we're interference detectives for what we call subluxation. So it's so important that each and every single one of you could have that sort of healing in your body, because your brain has the ability to heal itself. It just needs the right condition. So what we were talking about is just by going through and removing some of the subluxation in Sandy's neck, we were able to make a difference in her low back. So you might say, well, you know, how does that work? And we touched on a little bit this before, but there's natural curves in your spine. There's 4 of them. So what ends up happening is those natural curves help to dissipate the forces of gravity. So over time, and Sandy's a nice young lady of 70 years old, and she's got a lot of life left in her, is her curves are different. And I can remember seeing her x-rays and my eyebrows going up when I looked at her x-rays as compared to what our normals are. So we were able to figure out where things were not moving and work on bringing her back into position. And as she said, that she is 95% better from what she was when she came into our office, and they wanted to do surgery. So right now we're seeing an epidemic of women just like Sandy that have had hip replacements, but they have misalignment in their spines, especially at the point of where their cervical spine or their neck meets their upper back. So you can have a misalignment in your spine here that'll throw off the mechanics of your spine, bring your pelvis into a forward position, and because of this, over time, this change in your biomechanics will cause your hip to break down and get a hip replacement. So what we've been finding and helping women and men do is help to bring the curve in their spine back into the normal position and change their mechanics. I know one of the things that we're also working on is we've had another case of somebody that has had already spinal surgery and their cervical curve came back under chiropractic care. So it's not just Sandy, but we've seen it with other chiropractic patients that were making a difference with their spinal function and improvement already in their lives.
It's amazing, and I know Dr. Casen, with you've been doing the spinal adjustments to her primarily. Talk to me about, and talk to the people that are watching about what exactly is happening in her case, because her spine, because I remember seeing her, like a lot of times people wonder, how can you remember all that? There are certain things you remember, and her spine was.
And specifically in Sandy's case, I think you can do too much. So I think being focused and doing just what needs to be done has really helped with her nervous system and specifically her case, because we are being gentle yet specific with what we're doing so that her own body can heal itself. Because I think if we would have done it maybe a more traditional way, we could have overdone it and she maybe wouldn't be experiencing the results she is right now.
And I think that's really an important point, and I have to congratulate Dr. Anthony and Casen, because I've been practicing since 1978, and it's amazing what the new technology is today. So even though I have a degree in spinal engineering, I, being more of a traditional chiropractor, have learned so much in the last several months that exactly what Dr. Casen just said. So for all of you who are lay people who have maybe experienced chiropractic, and yes, I know that there's some of you maybe have had a bad experience with chiropractic, and that's okay, I understand that, but I also want you to know that 160,000 people die every year from properly prescribed medication. We don't do the traditional chiropractic adjustments on our patients. We may do that to some of the prior ones that are used to that type of care, but in Sandy's position, in her case, we have a table that we have had that was specifically created, engineered to be a very gentle drop table where the table itself works with the chiropractor as we make the specific adjustment. So like in Sandy's case, we only maybe moved 1 or 2 vertebrae. A lot of people traditionally get off the table and say, is that all you're going to do? So watch this. You're not compensating us for our time. You're compensating us for the knowledge that the Lord has placed in us that we are passing in. So in Sandy's case, we maybe have only spent 4 or 5 minutes of therapeutic time. Most of the time was figuring out exactly what we needed to do. And then we're going to do an assessment